Okay, I think we should get started. I want to allow as much time as possible for our speakers. So welcome to the College Research Seminar. I'm Marie Harvey, the Associate Dean for Research, and I'm delighted that some of you are here in person and others are joining us in the Zoom room. So what I'd like to now do is to introduce Rick Setterston, who is the Vice Provost for Faculty Affairs. And he's also a distinguished professor in the Human Development and Family Sciences program in our college. So he has graciously agreed to introduce our speaker and to moderate the session. So I'm going to pass it over to you, Rick. Take it away.
Well, I guess I'll just hold it.
Yeah.
Okay. Hi, everyone. Well, welcome to the Friday Research Seminar of the College of Public Health and Human Sciences. If you are joining us by Zoom today, we're using the webinar format, which means your microphones are muted. So please do use the Q&A feature within the Zoom webinar, and we'll read your questions out loud. So I'm pleased to introduce Dario Spini, who's here with us today from the University of Lausanne. He's a professor of psychology there and is the founding director of the Swiss Centre for Expertise in Life Course Research, otherwise known as LIVES. He's going to be telling us about the LIVES program today. LIVES was a massive 12-year enterprise, a research enterprise, but it also had a doctoral training program as part of it. And it was funded by the Swiss National Science Foundation. And Dario co-led that project over that dozen years with Laura Bernardi, Michel Loris, and Eric Widmer. As Dario will discuss today, LIVES really probed dynamics around vulnerability in the life course, looking at notions of vulnerability across different contexts, different life domains, and across the whole life course. It's truly a transdisciplinary project. So I had the great pleasure of serving on the scientific advisory board of LIVES from the very beginning, actually even before the very beginning. The beginning, when I entered anyway, was the idea was just being conceived. And the questions were, how on earth are you all going to pull that off? And they did to great delight. LIVES really, in the last decade, I would say, emerged as the hub for life course research internationally. And their collective efforts have not only advanced theories and research, but they've also made really landmark innovations in gathering life course data and analyzing life course data. And that 12-month project, 12-year project, just culminated at its end, culminated in this book, Withstanding Vulnerability. And it's actually free online. You can download it. So if you simply Google Withstanding Vulnerability, it will pop up. And you can download that book and get a great window into a lot of the work that came out of that project. Anyway, after 12 years, not months, Dario is on sabbatical. He's here with us for a month. And eager to get to know many of you and to get to know the work that's going on at OSU, and for him to be able to share some of the things that they've learned in the LIVES project in the course of that project. So to our delight and pleasure, we have Dario here with us and can learn from him today. Thank you, Dario.
Thank you, Rick, but also to Megan and Mary for organizing this seminar and for hosting me here at the Alifford Center. Yeah, I'm ready. All right, so I want to talk a little bit of what I learned actually in these 12 years. I'm thinking about what we did and try to figure out also if there is a lessons. So it will be a broad picture. No empirical research, but of course there is a lot of empirical research behind. But it's more like taking more abstract level reflection on what we did, and especially on the main concept that we used, which was vulnerability. And I will tell you more, of course, about that. But Actually, it's recently that I looked to some numbers in Switzerland and I tried to figure them out in the States, and they are more or less the same, not exactly the same, especially for chronic disease, which is much higher here in the States than in Switzerland. But otherwise, in our really rich country, of course, is vulnerability really an accident? When 16% of people have disability, when 1 in 5 US adults live with mental illness, when 6 in 10 adults in US have a chronic disease. Of course, it's not exclusive, all these categories. If you think that people around have to give care, and it's about 43 million of people in the States. And 37 million in poverty. So is vulnerability taken as a broad concept of, in different life domains, really something that, like an accident, or is it just part of normal life? And that's probably what I would like to discuss a little bit more, and which was also the subject of this first chapter, the introductory chapter of the book that I wrote with Rick Widmer, the co-directors of the program. And when we started Lives, we sold it to the Swiss National Science Foundation and to the government, the Swiss government, as overcoming vulnerability, thinking that vulnerability was something to overcome, and then you're fine, autonomous, independent, in good health, etc. And as you see, we finished more like inhabiting vulnerability or withstanding vulnerability. And so you understand already the story. But let me go in some detail. First, in the literature, basically you have two visions of vulnerability. One which is classical and maybe more common, the first one, which treats vulnerability more in a static way, as a state, as a syndrome, or as a lasting state of dependence or lack of autonomy, and usually related to the need of others or institutions, right? We have typical categories that are categorized as vulnerable, like homeless people, sex workers, asylum seekers, refugees, children, and the very old. We are vulnerable actually at the two ends of our life, and of course, at the end we die. And those who are chronically ill, typically. As a social psychologist, I also know that these groups are categorized as the least competent of society. This is something that stereotypically we think of this group of people. But there were warnings in the literature against this first way of seeing vulnerability. First, as the risk to have a paternalistic or oppressive idea of vulnerable people or vulnerable groups. Also to try to control them somehow, or at least to treat them in a standardized way. And of course, it could be a reason also to exclude or to stigmatize these groups. We have a second perspective that we were more keen to adopt, at least at the end. Maybe in the beginning we were more closer to the first one. And so the idea that vulnerability is actually a central experience of life. It's not something that is related to any accident or whatever, and it's part of life and part of the life course. And so the first statement, it's not an empirical hypothesis, but the statement is that we have all latent vulnerability. This is really the basis of our life, which in some situations, professionals or institutions may objectivize through diagnostics, through evaluative tools. The other important thing is that we wanted concepts that could be interdisciplinary. In Lives, we had psychologists, sociologists, demographers, historians, economists, etc. And so the idea was to have also a kind of neutral, or let's say not specific in a field, which is a weakness and a strength in the same time, of course. And we can discuss that later. We wanted also to relate it to social policies or to public policies. So that was also something that was really important for the program, that there would be some outreach and utility for society. We also defined in different publications what this vulnerability process and not state as a three-step process related to stressors, notably. The first one is that if you are vulnerable, you have more risks actually to face stressors. So that's the typical vulnerability hypothesis in life course research, that some people are more vulnerable than others because they risk more to face illness, to face different accidents, stress, etc. The second is when the stressor appears. So, and it's about coping. Vulnerable people usually cope more difficult, less effectively with the stressors. And finally, after the stressor appeared or was experienced an inability to recover from stressor. Or, and that's also something interesting, to take advantage of opportunities in a given deadline, because we never know what happens 20 years after, really. But at least in a given time, we can observe this. This is, for example, the case that was studied a lot by Laura Bernardi, for example, in lives of solo mothers who have difficulties to find new jobs, especially if they have children, because they cannot move, they have difficulties of planning, etc. So, and of course, they are less hired than others. So there are many reasons why they cannot take advantage and could be labeled as people in a vulnerable situation. So the basic definition we gave is really about the dynamic of resources and stresses. And most of the research was around these topics and reserves, as I will present you also, that came up later in the program. So stressors, of course, it's not only psychological definition of stressors. We relied a lot on the work of Perlin and colleagues that really say that it also spread across the social spectrum, and it's also a social experience. Stress is not only related to individual resources, but also, of course, to our social positioning. And resources, well, increase the likelihood of meeting social expectations. So as I said, we also introduced in this discussion the concept of reserves, because resources is something that is not always time related, is not also, just to give you a difference, a simple metaphor, resources could be the income and reserves could be the bank deposit, right? Just to give you a very simple idea of the difference of the two. And what we say is that these reserves as dormant resources, maybe you will never use it, but if they are sufficient, they are available for recovering from life shocks and adversity and transitions, etc. So resources, well, reserves are a type of resource, let's say, but in the same time, they have a different function or a specific function, which is to face non-normative stresses or whatever happens in life that could result in a vulnerability trajectory. And the other idea that is really important in this series of a reserve, which come from neurosciences, and we try to apply them to more sociological work. And of course, sociologists wanted to use capital, so there were also a lot of discussions about the difference between the two. But the idea here that is typical of reserves and in neuroscience is that you have thresholds. If you are above the threshold, you can cope, you can adapt to the situation or recover your previous situation. If you are below, actually, you end up at a lower stage of functioning. Okay? That's basically something that is also important in these reserves, and which is also difficult sometimes to apply to sociological thinking, because how many friends do you need? No, it doesn't work like that. You need a certain quality probably, and that's more difficult to just quantify. I remember when I was working on frailty in very old age, there was a paper by a biologist, if I remember well, Gross, and or Bort maybe, and he was claiming that any system who has less than 30% of reserves cannot adapt to an accident, or to, if you have 30% or less than 30% of calcium that you should have in your bone, it doesn't, you cannot restore it, and things like that. I'm not sure that in the complexity of social sciences we can have these kind of universal rules like in biology or in other disciplines. Just to summarize, I'm really bad in trying to make a summary of the processes, but I thought it was interesting just to show maybe the difference of thinking. The first one, overcoming vulnerability, takes autonomy, or, I mean, you can use different words actually here, as a normal situation, right? As a norm. And if you keep this trajectory, then you are resilient, following psychologists like Bonanno and Mancini. And of course, you can face stressors, and then, or you have enough reserves or resources, and you stay in the autonomy or resilient trajectory. Otherwise, you go to vulnerability, and then, or you recover, or you stay in a lower level of functioning, which is called vulnerability by many people. And these were the reserves, by the way. When we say withstanding, we start actually from vulnerability as a normality. I mean, as a background or backbone of our lives, which is in most cases latent, which is good somehow, because we don't want, of course, to be always vulnerable. And of course, if you have enough reserves or resources, that you also, and here childhood, of course, is really important, because that's the period where you accumulate also cultural capitals, etc. I mean, learnings, education, etc., social skills, emotional skills. I mean, all these things. Of course, you go to more autonomous life, and you can keep it, but in the background, we still, it's a more dialectical way of thinking, it's not. And then vulnerability is normal, or latent vulnerability in this case. But of course, life is more like one of the results of the problem is that there is no linearity or no simple way of sometimes people go up and down, some others are more stable. I mean, the diversity of trajectory, of course, is the first result of any longitudinal study. And that's what is really so interesting to observe. But what is important here is that the two visions of vulnerability don't go in the same, don't see normal life in the same way. I mean, the value norm of autonomy, what do we hear in families? What do we hear at school since the beginning? Autonomy, we should be autonomous. It's a very strong norm of our societies. liberal societies or advanced or whatever you call them, autonomy is really what we have to achieve. And we are more or less autonomous and competent. And of course, if you're not, you risk to be targeted as vulnerable or discriminated. In the second paradigm, vulnerability is normal. So the need of others, for example, we sometimes seen as a weakness, or feminine things. I mean, in the gender stereotypes, there is a lot, of course, that is related to this. But the need of others is normal. It's not part of normal life. We should be educated to ask for help and to give help to others, not to be autonomous. That's not the same school, You cooperate or you compete. That's not the same school. I really believe now that we are in the wrong path. I'm not the only one by chance. There are some philosophers also who think much better than me and who can help if you want to read a little bit about that. For example, I don't know if you know, Alasdair MacIntyre is in Notre Dame. Sorry, it's hard for me to say an English word that is French. I feel like I'm not speaking the right way. So, for example, in this one, which is easy to read, it just says something like, it's more about moral philosophy. So it talks about virtues and things that are not always followed, but he puts really vulnerability in the core of his thinking. And for example, here a quote, "And when the ill, the injured, and the otherwise disabled are presented in the pages of moral philosophy books, it is almost always exclusively as possible subjects of benevolence of moral agents, who are themselves presented as though they were continuously rational, healthy, and untroubled." And what he argues is that instead of a we, they, which is the overcoming, we should have a we, we are just all vulnerable. And then, of course, the challenge is to enable all of us to gain autonomy on this basis, which is a different way, of course. And I was really happy to read that recently, actually. When I changed my mind, I said, who is thinking like that? Of course, there are always good thinkers that did that before you, and here is one. The other thing is that it's a kind of paradox, but more I'm working on vulnerability, and more I think paradoxically to the resources and reserves needed to become more autonomous or more dependent or more agentic or more or happier, or whatever you use as a standard. And so the rebuilding of reserve, the adequate use of resources and resilience are paradoxically the focus of the vulnerability or the withstanding vulnerability, more than to understand why some people just are depressed or whatever. So that's also interesting. And so that's basically what I wanted to say about vulnerability first, so that we moved from one paradigm to the other, not all, but at least I did. And I think that, it gives me more joy actually to think to vulnerability like that we share and that it's normal and we can help each other, than the first way I was seeing it in the beginning before we really worked on all this. So that's the first part. Second part, and that's related to the book and some snapshot to the book, is that, of course, we wanted to study vulnerability and resilience because, as you maybe understood, it's more dialectic between the two and not one against the other or one after the other, in a life course perspective. And there we adopted three principles that were already in the life course paradigm, but that I think we really picked up as the main one, or selected as the main one, in a paper, first paper here in 2017 with Laura Bernardi and Michel Horis, who were the co-directors. We made this, and there is nothing new, but the idea, of course, is that if you talk about resilience of the people or of vulnerability, you have a holistic view. And so you think in more than one domain or in one specialty. And so it concerns all our life and all the different dimensions of our life. And you will see what we worked on that. The second one that I worked more on is, of course, that vulnerability is not defined per se. It depends on the context. It depends on relationships you are in. And depending on the culture or the country, depending on the historical period, depending of many things, of course, you will not get the same definition of vulnerability. And who is vulnerable or not, who is poor, depends on the country where you are. The definitions are related to the country definition of poverty. Health-wise, we know that the DSM, the manual for diagnosis for the psychology. Okay, all right. Evolves also the definitions of who is mentally ill or psychologically ill or not, or psychological functioning or not. Really also very quickly sometimes change because of political reasons or whatever, and can change, or discoveries. So multi-level, I always say to my students, if you put me in a box ring, I'm really vulnerable. So it depends also where you are, of course. And the third one is multi-directional. So we are interested in trajectories. And of course, all these trajectories are interesting. I just took here the Bonanno and Mancini definition of growth, of recovery, depending on where you are, where you stand, what happened, the vulnerability, resilience, because you can be stable in vulnerability. We saw that with very old people, for example, they can stay frail for a long time before dying or entering into dependency. And of course, when you lose resources, that is also called sometimes a vulnerability process. But these three principles are really also organizing the book: multi-level, multidimensional, multi-direction. So I just want to pick up some of the ideas. Just to mention that also. Maybe you know it. But Laura, Johanna Sirink, and Rick also took these three principles as the life course cube, as they say, as a tool to think about the life course. What they added, I think the book is weak in this sense. I mean, we couldn't really put everything together, but I think the richness of this model is about the interdependence of the multidimensional, you can do a lot of hypotheses then if you just cross all these dimensions, 3 dimensions. Then we disagree on the multi-level, but we have to talk about it these next days. Maybe we'll come up with a solution. All right. So first, the multidimensionality, just some snapshots. Again, it's not just read the book and see the papers if you want to, if something interests you. So here, each part of these 3 sections actually have a synthesis. So where we try to say what we learned also on these principles. And Laura Bernardi was leading this group on multidimensionality of the life course with Danilo Bolano. Really hard to say Danilo Bolano. You always mix. I always say Bonaro or things like that. I like to read it. And of course, the interdependency of life domains was really at the core of many works. And we were really interested in spillover effects. So probably you know that, but with the idea that when loss or gain of resource in one domain has an impact on another, right? This is a spillover. We were also interested in, but it's also in the multi-level principles or link-like principles of the crossover effects. Maybe you heard of that also, that if someone lose or gain resource, has it an impact on someone with links? So the more This is a crossover. But here the spillover effect, and they conclude this thesis by arguing that actually current policies addressing specific life domain at this time have often unintended consequences that shall not be neglected. This is clearly silo. You say silo? What? Silo. Principle, of social policy. They target one specific domain, going back to work or getting out of poverty or etc. I mean, just they are very specific. And one of the conclusions about the relationship between this principle of spillover effects and social policies is that, for instance, policies increasing pension age, right, do not only shape the employment trajectories, but also the leisure one, also the care one, or the relocation opportunities. I mean, many things are impacted by one single. So that's also part of the spillover effects and the effect of social policies that we study. Here, an example chapter, many chapters for each part, but of course, I take just one or two because we don't have the time and it's going very fast. So, for example, very classic, but the work-life balance was clearly one subject of the topic, especially for middle-aged adults. Gender issues also behind. And Alexandra Freund and her collaborators, did a lot of that. And surprisingly, because they had the first paper where they showed that there was a difference between men and women. Women suffering more from conflict between domains, leisure, work, family, and men, and also benefiting less synergies or facilitation effects, as they say, between domains, because this is also interesting to understand. And at the end, actually, they argue that there is no such a big difference, which was surprising to me, because I was always repeating there is a difference of gender, etc. And they say when there is one, it's always the same, and women are disadvantaged in this interdomain spillover effect or facilitation effect. But they conclude, surprisingly, that across different studies, and when you see the literature, actually both men and women suffer from when they have conflict. Then maybe this, as we saw, vulnerability is about also how many people have this conflict, which is maybe there you find a difference. But when there is a conflict, actually both men and women suffer, right? But they don't discuss as sociologists about it's a psychological team, so they see the process for women and men, and if it is the same, but they don't look to how many men and women suffer in society. And I think that could explain also the lack of difference. Multi-level perspective. So the second big perspective, the life course perspective on vulnerability. So here, Enrique is also part of the story here, but you probably know the agency in structured paradigm, which probably is taught here. Actually, we worked a lot on the meso level. We thought that the meso level would be really, really important and was neglected in a life course tradition. Or you may say that it's part of the structure, but we think that the meso level is something that was quite neglected. And we ended up, of course, all these trajectories within meso, within macro. So 3 levels more than 2, which is also quite classical. But let me tell you a little bit what we did. Concerning the meso level, there is a lot on social capital and the importance of health, of social capital on health trajectories, especially. We didn't work so much, but at the end, there were some works on neighborhoods, etc. So another neglected dimension of the life course is usually geography. And I think that's a topic that will come up very strong, or at least that I'm working on now. So you always feel that what you're doing is important, but I really think that it's part of the meso level, and we forgot it in many life course work, geography. And I will give you some ideas of this one, maybe, because time is fleeing. So let me give you this snapshot on me, led by Jean-Michel Bonvin and Jean-Pierre Tabin, with Anne Perriard, Emily Rosenstein, Max Loret. They were interested in policies. And for young people to get to the job market, well, it was a lot about work, but not only. And of course, they acknowledge that social policies give resources, or at least try to transfer resources to the people engaged in programs. But they say that their empirical observation has shown that social policies may also reinforce vulnerability in some cases. And they show, for example, that vulnerability, as it is experienced individually by people who are targeted as vulnerable people, are confronted with macro or political definitions of their state and the policy that is needed. And then at the meso level, there are street level bureaucrats, there are people who actually translate these policies for the people they have in front of them. And they show actually that they manage differently, different types of people, different situations, and they have some margin of negotiation in between what the people need, and they are important in the application actually of the translation of public action. So, for example, and so we study these gaps or discrepancies between the individual feelings or experience of vulnerability, the social, political, or public definition problem, and the meso level negotiation. For example, a work by Claudine Burton, well, a chapter by Claudine Burton, Jean Gros, and Vanessa Farnioli, it's actually the PhD of Vanessa, worked on HIV-infected women, right? And they showed that actually the definition that these women gave to their illness was very different from of the physicians. They were telling them, you have no symptoms, you can function, if you take your treatment, you are normal somehow, because you can be autonomous. But when she interviewed these women, they actually felt ill. They had an illness. If they stop their treatment, they die. So they don't feel like being out of the problem as the system. And she showed this contradiction, and how actually many women who face this, the health system, don't find what they look for, some recognition of their state, for example. So it's really interesting, and in the qualitative work, she did a lot of empirical work, how these contradictions actually work in the health system. Then the multidirectional, let me go directly here. So it was a lot about reserves. So as I said, we targeted this concept as really important, and without, I'm not really surprised, but of course, education shows to have long-term effect. So we were also interested in long-term effect with this multidirectionality, and it's an important reserve that can have impact on health. Of course, here the welfare states and all the policy we have are really important. But of course, so that's one. I don't know if there was another one by Andreas Ile, also on aging. They show, for example, also that inter-individual differences throughout the life course was the main cognitive relation research, and they show that they have impacts on the health trajectories in older age. So this kind of, very long effect, we never know exactly how the mechanisms, but there is clearly an association that we can empirically document across many studies. So these are some examples of the studies. And Eric Winmer was leading this cross-cutting issue of multi-directionality, so that the resource reserves are important in long-term trajectories, and with various outcomes which can be related to vulnerability or resilience. And they show also that it's non-linear. I mean, it's not like you just accumulate. I mean, Danifer's thinking and others, the accumulation of disadvantage, advantage, where you just have within a cohort, doesn't really work on many dimensions. And it's not so automatic or so simple, usually. Okay, how we go on. I will also skip, but just mention also that a lot of methodological issues were tackled by lives. And in order to study vulnerability and life trajectories, we developed life calendars, we developed network methods. And I think we were, the methodologists, we were very strong in combining methodologies. And you will have examples in the book of how we can combine different types of especially quantitative data, but also mixing qualitative and quantitative data. So, and I cannot go into details on that. So just 2 slides more. Oh, maybe not. How can I stop? Yeah, maybe I stop here. I think the messaging. Yeah? Okay. All right. So I would have a lot to say, and we can discuss that afterwards. But clearly, having such an abstract concept as vulnerability or resilience is also a problem for many, many researchers that want to publish in a discipline, in a specific field, and they were translating it in different ways, depression or unemployment or whatever, but they couldn't really rely on that, and they didn't want some of them. But I still think that we need some concepts, interdisciplinary concepts, and I think and holistic ones that can show something beyond each specific empirical work, which has its value, but somehow we also get lost or we lose the big picture of how the life of people actually develops. And so I'm not sure it's pros or cons. Actually, I changed that several times. I didn't find how to express it, but that's maybe what I believe and what others believe also. And so, of course, I think that this holistic view of people is really needed. And I think you mentioned that as a definition, actually, of the life course in some place, that we need a holistic, it's a holistic view of the development of people, and not only a specialized one or that one that has to be tackled in silos. And I think the multidimensional principle here is really important. I think vulnerability had a lot of people think they know what it is. So for social policists, and for people who are more in applied sciences or people who are just outside the general public, it has a meaning, right? And that was, I think, a relevant also a concept. That I think I explained the idea that actually we get into a more dialectic way of thinking about vulnerability and resilience, that things that are always here somehow at different extremes or at different levels, but that it's not when you're autonomous that you are not vulnerable anymore, and etc. And I think the norms here is really important somehow to discuss at some point. And we don't discuss that enough, I think, in society. Or the dominant one imposed to the others, one can say, in a more Marxist way of thinking. But clearly, I believe more and more that actually, if you think we are all vulnerable, you become more benevolent. And if you don't just stress, we should be autonomous, strong, independent, etc., which is really the main message of school and main message of families in many parts of the world. And I think we really inhabited this concept of we should be strong, autonomous, showing that we can compete, that we can succeed, etc. But well, of course, some would say also it's a feminine and masculine way of defining society, or paternalistic or whatever. But we don't discuss collectively enough, I think, of what we want as a society. And many people, I think, feel that there is a discrepancy between what they live, what they observe, what they experience, and what they should be. And at least that was the case for me. All right. I think I said most of the things. Thank you very much.
That's the fun part where we get to have a conversation.
Yeah.
And ask questions and lay out some ideas. So who wants to get us started? I know if you're online, please go ahead and pose a question in the Q&A feature if you like. But let's get started here.
I will watch.
Okay, you want it. Excellent. Carolyn, you want to get started? You look eager to say.
Oh yeah, there's lots. I want to add. This is a very complex subject.
Yeah, for sure.
I want to add.
Yeah.
So long time ago, when I was first up, right? Dan Stockles and I came up with this deviation application model. Right? So we have a stressor. When do you get a vulnerability, and when do you get a positive growth? Right? And turns out that was too simple. Just like Dan and Fer, she used it. Right? Because what Crystal Park found was that you have post-traumatic growth and PTSD in the same people. And right, and so Sunaya Luther came up with the idea, which I like very much, is a patchwork. That people are patchworks of vulnerability and resilience, and understanding the interplay. And you could argue that's not just people, but the meso and the micro and all the different levels. And so vulnerability then is a function of resources and challenges, right? Which is Lazarus's definition of stress. Right? So coming up with how you look at patchworks, you can do with like profile analysis, which get really interesting.
You're thinking
Within.
Yeah.
But you can apply the patchwork ID.
You could, absolutely. And my very favorite anthropologist, I named or AFX, argued that culture grew ways, that there was no monoculture, that within a culture, there were subcultures depending upon your gender, your age, your ethnic group, your work status, your SES, et cetera, et cetera, et cetera. And so, so you could look at patchworks of vulnerability and resilience, within a culture or within a community as well. And so that was when insight gave rise to strength-based interventions rather than interventions focusing on vulnerability. Right? So how do we identify the strengths within a person or culture, and how do we build upon them to get more resources?
No, I strongly believe actually that, and that's why also I said education is important, but it's not the only way we should behave collectively to help people to function and to be happy. Because I think what you do with a child is not what you do with an elderly who has Alzheimer, etc. But even in this situation, you can do a lot. And I think that's really important not to see just one group of vulnerable people and one other who is not, etc. And to see, as you said, that each individual, within individual, we have strength and vulnerabilities. But of course, then it's the difficulty then is on the data we get, because sometimes you have only one part and not both parts together or at the same level of complexity. And so that would call, for different ways of also assessing the strengths and the resources and the latent vulnerabilities or manifest or observed vulnerabilities of people. And I strongly believe that, for sure. And that's why I said it's a dialectical, I go more to a dialectical way of seeing vulnerability and resilience, not just as one trajectory, but something that is more mixed. And that's misleading when I say just the trajectory of, you're right. I mean, within, we have both. Yeah.
And I think the dialectic may lie on interdependence versus autonomy. So I was looking for that word because the idea of the benevolent society, where we all rely on each other because we all have vulnerabilities.
Yeah, of course.
Other questions?
You mentioned that. I mean, I'm curious that it's not having and it's the best way to get at that. Can you get at both things?
Well, I think she.
Can you read? Sorry.
Oh, yeah, we questions.
But maybe you can answer because you did it.
No, that's what we do. That's so the other complexity, and I'm sorry, can you
The people online keep hearing you well, so.
Sorry.
Myself.
Oh, we have to repeat that question.
So I'm happy.
Okay, well, you can repeat the question once. It's up. Whether you do it. So Megan's question was about measurement, but remind me, measurement of what?
How do you look at vulnerability and resources?
How do you look at vulnerability and resources within individuals? Yeah, gotcha. All right.
Well, I think, the main difficulty for me is about these latent vulnerabilities. How do we define and measure them? Because they are not observed. We talked about, for example, more at the level of norms, about misleading norms, but the case was somehow a couple, they make children, they decide that one works more than the other, usually the woman works less, and at some point they divorce. Okay. Until the point they divorced, it was functional. But the woman actually accumulated latent vulnerability. So, for example, we could measure the insertion in the job market or the training she had. We could measure, who will take care of the children, if she had resources to take care of the children or not. It's Switzerland, in many cases, if you don't have work, you cannot leave your children at the daycare, so things can be also circles like there. But I think that if we go to understand better which latent lack of resources or reserves can lead to different states, we can measure them. So that's why also I think life course research is very important, because the answer is not at a given point of time where things may seem just perfect. But then you have a stressor, divorce or separation, and then this latent vulnerability show up. And we know many of these cases. So I think we could also think to what we already know and think that we should measure this and maybe say to this woman that we could be preventive, saying, hey, especially women, sorry, but this is the case of precarity, at least in Switzerland, is usually a solo mothers with many children leads to poverty or at least financial difficulties. This is a specific case we know well. And to say, we don't accept, continuous training, for example, even facilities, especially for etc. Then you have to decide if work is a goal for everybody. That's another issue, but at least you can have preventive ways of thinking to what is a latent vulnerability And I think this is really important in what I was saying, that we have to think about life trajectories, and not only like, yeah, I have strengths, I have resources, but what we accumulated here is a knowledge of the risks, and I think that's really important to advance then to social policies, to things like that. But usually, social policies think in really at the present. I mean, we had discussion with the local, well, the regional government, which is powerful in Switzerland because it's a federal state. They didn't have any, when they were helping someone, when he got a job, they don't keep the information that they had before. They just put the last state in their administrative data. So someone is employed or unemployed, but they don't know how many spells of unemployment or employment duration, etc. No idea. So the people in front of them are just employed or unemployed. It's the only thing they know. So I think this also is part of the story, that we can intervene at different levels to better understand actually the trajectories of people. And I think, well, that would be my answer.
We have time, actually, that clock's a little bit fast. I think we have time for one. Right. We'll actually give you the light for one.
Yeah. Just become a very...
Yeah, hold this for me. Okay. So I was wondering what your thoughts are on leveraging the spillover as like a point of a positive intervention.
Yeah. See.
Yeah.
If in the way that you were defining it.
Yeah.
Yeah. And the crossover was
yes.
a ripple effect on.
There are really surprising research that you probably know. For example, that's what comes to my mind. But for example, in order to give some resources to, for example, young people who have difficulties to enter into the job market, they now do programs of theater. You would think that culture would not help much, but actually they gain some competencies in talking, in staying, presenting yourself, in cooperating, because they do everything together, etc. So these young people who are really somehow in difficulties in the model of training, work, retirement, actually gain a lot of these kind of activities that you wouldn't think it's a targeted, work. I know, for example, also, you probably know also that, for example, culture, I think, is really important. And we neglect how much it is important in our lives. For example, doctors now, I don't know if it's in Harvard or I don't know where, they go to museums. They go to what? Museums? What did I say? We have discussions like that always. I don't understand myself when I hear him. And they may be understood. Leave me a chance. Yeah. And it seems that if you are in front of nice culture, objects or things they can see, well, they are more, let's say, not benevolent, but there is another word.
Benefit.
Sorry? No, they take more into account. Yeah, but there is I don't find it here because I begin to be tired. But the clinical feeling that people can have, understand each other, and like in Rogers.
like on serious mind.
Empathy. Yeah. I just say it, but you're English, you know. In my ears. Sorry for that. A long guessing. So 1 point, Megan. Empathy. So empathy increases. So there are cross-domain things. And on the inverse, I mean, the psychosomatics, for example, we don't understand anything about it. We know there is something very important there, but we need so much more knowledge on this. I mean, there are many spillover things or interdependencies things that, and that's good for research. I mean, because it opens new ways of thinking. I think this kind of principle, and explorations also, experimentation. So I think it's nice, but I don't have, we didn't have all measures you could do to spill over to, but that's the way, yeah. We saw more the contradictions. It's easier somehow because they are there, you can observe them. But of course, there is also the will, at least there was a mandate also of lives to create new innovation, interventions, things. So we did some, but not always in the spillover. Think more to see if it was spillover or not.
Okay, so go ahead.
Sure. Yeah.
So I've worked over the years to try to help do more interdisciplinary research. So can you tell me how you brought together such diverse disciplines to work together and to discover such great things? It's such a challenge.
Yeah. The director of the Polytechnic School in Lausanne was asked, how can you lead? I mean, no, he was interviewed, and someone told him, now that you have the authority, and how will you manage the school? He said, well, managing professors is not really an easy task. And he said something funny, at least. I don't know if it's useful, but it's funny, so that's why I'm saying it. He said, having an army of professors is like having an army of cats. The only thing you can do is take the food somewhere and is to move the food. So I thought it was useful, at least when I had some money to distribute. So, for example, any project who would receive additional money should have been led by at least 2 colleagues from different disciplines or institutes or whatever. I mean, we tried always to favor not a single individual, but ideas and collaboration. But of course, otherwise, informal meetings are really important. I mean, having lunch together. Many projects actually were created around the table. So I'm not sure it's management technique, but at least it's useful. And just leave people talk and together and see if they get well together, because that's the first thing. They need to have something in common. But then we tried also, for example, to have different initiatives. Some were more successful than others. I don't have my glasses, which doesn't help. But I remember that I had a slide. Thank you. Where is it? I think it was near the end. What we tried also to do, and I think, oh yeah, it's here. I don't have internet here, right?
Oh, you should have that. Sorry.
Is it? Yeah. Does it work? Yeah. What we tried, for example. Yeah.
It was not set up.
Okay. So, for example, we developed a wiki of definitions, and each concept was also defined by more than one people, for example, and we share that. We should share that.
To the extent of
Yes, exactly. So that's something we did, for example, that could be done also here, probably different issues. So that's not interdisciplinary as you would like it to be, maybe, but at least you do small pieces, and that it works because it's concrete. Concrete things work. If you want to go too far, sometimes it's really difficult.
Thank you.
You're welcome.
So please join me in